Dental crowns are like ceramic shells that we cover the tooth. We use ceramic crowns especially when the tooth is too weak and when we have a large decay, very old and large filling that we need to protect the tooth. So the dental crowns are used to protect the tooth. The difference between crowns and bridges is that a bridge is a different procedure. Different is used when we have a gap, when we have a tooth missing, and then we have two neighbor good teeth. So then we do a bridge. We have two pillars of the bridge, and one is called a pontic, or a tooth that is floating on top of the gum, and that structure is called a bridge. At ArtSmiles, I consider ceramic as our gold standard for crowns and bridges. We have a very good workflow with ceramic. Ceramic is a very stable material. Over the years, it doesn't deform the material. When we work with composites, it's different. Composite, I see that after some time, after some years in place, I can see that the margins of the material starts to degrade, starts to crackle. Another thing, ceramic is very good with stain. Ceramic usually doesn't stain. If you drink a lot of coffee or red wine, this is not going to be a problem with ceramic. But this is a problem with composites. For crowns, we used to say here for us, it's a simple procedure. For us, it's everyday procedure. You know, it's something that we do all the time. If there is an option that is more conservative, of course, we're gonna offer this option. But if we can't, then we need to go with a crown. So we have an initial discussion. Then, of course, we're gonna numb the tooth to be able to treat, and then we shave the tooth. This takes maybe, let's say, half an hour or so, a bit less. We scan the tooth, and all the design is done in the computer. The patient can see when we are designing the crown. Sometimes they can give their input as well, you know. Oh, yeah, make the tooth a little bit more pointy, you know, and this is something that we can do. And then we mill the crown, takes more 20 minutes or so. So that's why we need 90 minutes, and then the crown goes to the oven, and then after more 10 minutes, it's all done to cement. In our clinic, we can do everything. We have all the machinery, we have all the equipments to do the crowns in one sit. You know, the patient comes and we do the crown in one go. In just 90 minutes, everything is done. To look after your crown is similar to a normal tooth. Okay, you need to brush, you need to floss. If the patient doesn't have a good maintenance, it's a nightmare over there after some time, after a few years. And I've redone so many cases of bridges that fail after 5, 10 years. Why? Because people don't know how to floss underneath the bridge. I see a lot of decay here in this area between the pontic, the tooth that is floating, and the pillar of the bridge, because you can't floss from here, from the top. You need to use a flosser that goes, you know, in between. That's why I love water flosser, because you can put the tip of the water flosser here, blows the water, removes the rest of food, keeps the gum healthy, prevents decay, and then you reduce the need for flossing in that area. So that's why you have to have a good, especially with bridges, you have to have a good oral hygiene. Otherwise, you're going to lose the bridge, not in 1 year, but definitely in 5, 7 years, you're going to lose the bridge if you don't floss, if you don't clean properly. One concern that people have is about the shade match. Shade match is something important. A crown could be noticeable in the mouth when we selected the wrong color of the crown. Here, our name is ArtSmiles, so it has to match. You know, for me, I don't feel happy if it's not matching, especially in the front. It has to be, you know, the best possible. When it's well selected, the material, the technique, the case, we can achieve amazing results.